Hey guys, in today's micro lecture, we're going to talk about time critical patients. Now, the good news is approximately 90% of the cases that you will be attending to as a state paramedic are not time critical patients. Now, when we say time critical, we mean that their illness is so severe and so acute that if you do not act quickly enough, they're going to die or at least have some terrible outcomes. So what do we mean by time critical apart from you've got to act fast? Now, any patient who presents with an airway problem, a breathing problem, or a circulation problem is what we call time critical. So what does that mean from the paramedic perspective? Now, first and foremost, the thing I'm going to say is that when you first receive that case on the mobile data terminal, don't always trust the information that you're given. So, for example, you might be sent to an unknown problem. You might be sent to something that is completely different when you arrive on scene to the information that you've been given. So the first step is to never completely put your trust in the information that you're given, because that information is only as good as the person who is actually putting in the call and the dispatcher who is interpreting it. So always going with a fresh and open mind. Then when you arrive on scene, you have to make some decisions about how ill that patient is. Now, we've talked in previous sessions about using the patient assessment triangle. Now, the patient assessment triangle consists of three phases. That's the general appearance of the patient. In other words, have they looked at you as they've walked in? The circulation to the skin. Do they look pale, sweaty, clammy? And the work of breathing. So are they breathing normally that you'd expect with normal quiet breathing at a rate of 12 to 20? Or are they using their accessory muscles to breathe? Once you've done the patient assessment triangle, and that's something you do, by the way, as you're walking into the address and approaching the patient, and it's not something that it's not a hands-on thing, but it's more of a step back, looking at your patient, physical, visual assessment. Then you need to do your primary survey. Airway, is the patient's airway clear? If not, open it and clear it. If you can't open it and clear it, you've got a time-critical patient on your hands. If you can, check the breathing. If the breathing is not within the rate of 12 to 20, or it's labored, or there's another type of problem with the breathing, let's say, for example, there's added sounds, you need to deal with those right then at that point in time. Let's say the breathing's fine, but there's a circulation problem. As you know, the heart rate at rest is 60 to 80 beats per minute in the adult. If it's over 100 or below 50, and the patient looks sweaty, pale, clammy, or there's some other kind of symptom, then again, you have a time-critical patient. Now, even before we do any of those checks, if you've arrived on scene and the patient has got catastrophic hemorrhage, again, you have a time-critical patient. All of these situations require a fast, rapid movement from the paramedic to be able to deal with those situations. Now, it's beyond the scope of this 3-minute micro lecture to discuss every single time-critical situation, but this is a snapshot into the world of a time-critical versus a non-time-critical patient. I hope you've enjoyed this 3 minutes. My name's Sam, and I look forward to working with you again shortly. Cheers.